Hello, everyone, and welcome to this telephone town hall. We'll be joined in a moment by Congressman Tim Ryan. This event is on healthcare, and the Congressman would like to take your questions live for the next hour. All you have to do to get in line to ask a question is press 0 on your phone at any time, and we'll get you in line to get a question. This event is designed to, get you connected directly to Congressman Ryan so that any questions you have on health care can be answered from him. There's a lot of misinformation out there, and the Congressman wanted this opportunity to talk to you directly. And Congressman Ryan, are you there?
I'm here.
Cool.
Should we wait until everybody gets on, or?
You can start your say whatever you want now, and we'll have people join throughout the next 10 minutes or so.
Okay, very good. Well, first let me just say good morning and thank you, and I appreciate the opportunity you taking some time to have a discussion about the healthcare situation in our country and what we are attempting to do. I think it's a very exciting time, but also a time where people on all sides of the political spectrum get pretty excited. And so because I think this is such a bold reform proposal that a lot of people have taken pieces of the bill and the different bills that are in the House. There are now 3 bills in the House of Representatives. There's going to be 2 versions in the Senate. All of this needs to be reconciled. But I want to talk to you for a couple minutes about the healthcare problem that we're having in the country, why we need to do something, why it's imperative that we do something this year, and then really open it up for questions and allow you to ask me questions. Again, all the details have not been worked out because of all the different versions, and there's going to be a lot of changes left. But one of the things I pushed for before we left in August was to wait, so we would get an opportunity to come home and go to the festivals and be able to talk to everybody about over the course of August about why we need health care. So basically, the problem that we have now with the health care system in our country is it's growing at a rapid rate. Health care is growing at about 9% of our gross domestic product. Or healthcare is increasing at 9%. Our gross domestic product is only increasing at 3%, which means over the course of the next decade, 1 out of every $5 that's spent in the United States will be spent on healthcare. Over the course of the next 30 years, 1 out of every $3 will be spent on healthcare. And all of you know that this increase in healthcare is eating up more and more of our families' budgets, and it's eating up more and more of the Medicare budget as well. So we need to fix this problem. And one of the main problems we have, I'll talk in general and then specifically about Medicare and then go to questions. We have a universal health care system now. The problem is that people use the emergency room to get their primary care. And some people say, well, I don't want to pay for those people. The problem is we're all paying for those people now, the 50 million Americans who don't have health insurance or have inadequate health insurance. Go to the emergency room. The doctor doesn't get paid. The hospital doesn't get paid. So what happens is the doctor and the hospital charge those people who have insurance more to compensate for the people who don't have insurance, who show up in the emergency room. So those costs are pushed off onto others who have insurance, Medicare program, a private insurance and whatnot. So what we're trying to do is say it would be easier if we would have those people covered. Since we're already paying for them, why not give them some basic coverage? And that way they would have preventative health care. These people show up at the emergency room and cost us $100,000 or $200,000 because they didn't have the proper preventative measures, the screenings that maybe they would need, the mammogram maybe that they would need, the cervical screening that they would maybe need, all of these preventative measures. So they don't get that. And then weeks and months and years later, they show up in the emergency room and cost everybody a lot of money. and that gets pushed off onto Medicare, it gets pushed off onto the private insurers and everyone else. So we're paying it, and that's how we're having these huge increases every year of 9, 10, 15% in healthcare cost increases because we have a poor system. It's rearranged poorly. From the Medicare perspective, we see it in Northeast Ohio a lot, and we see it in the Mahoning Valley a lot too, where people who are 55 or 60, they lose their health insurance. They worked at Amwell, they worked at Youngstown Steel Door, they worked at Delphi, or wherever the case may be, and when they're 55 to 60 or early 60s, they lose their health care. So what they do is they have the same problem. They try to get a COBRA coverage or they try to get something else, but it's either too expensive or they can't get it because they have some kind of pre-existing condition, heart disease, diabetes. So these people in many instances say, you know what, I'm not going to go out and get health insurance. I'm going to wait until I get into the Medicare program because I know I'll get coverage then. And so what happens is we have a very, now as the baby boomers are moving into Medicare, we have a very unhealthy consumer, a very unhealthy patient going into the Medicare program, and that's driving up Medicare costs for all of us. So instead of getting a hip replacement or a knee replacement or heart surgery or whatever on your own private insurance, these people wait, they go into Medicare, their disease or their problem becomes more chronic and therefore more costly, and that gets pushed off to Medicare, and that's driving up Medicare costs. So when you hear that we're going to save money in Medicare, we're not going to cut anyone's benefits. A lot of the savings is going to come because we're going to have a healthier person going into Medicare because now a lot of those people don't have health insurance, so they don't have the prevention. Under the plan, we want to cover all of those people so that they are getting preventative care and they're getting their problems taken care of, and therefore they'll go into Medicare a little bit healthier. So under Medicare, there will be no benefit cuts. I know, a lot of people have been watching TV, and, my mother is in Medicare, and I have a lot of family members in Medicare. We're not going to reduce benefits in Medicare. Actually, Medicare is going to get more comprehensive benefits. We are going to fill the donut hole. And the donut hole, for those of you who access the Part D program, I think it goes up to about $2,700 now for drug coverage. Then there's a donut hole where you don't get any benefit until you get up to about $5,000 or so. This bill begins closing down the donut hole. And immediately, you may have seen President Obama working with the pharmaceutical industry. Immediately when this bill goes into place, there'll be a 50% reduction on top-shelf drugs in Medicare Part D. So if you fall into the donut hole, there'll be an immediate 50% discount given from the pharmaceutical companies because of the agreement the President reached to save money right out of the gate. So there will be an increase in benefits. There will also be an increase in the assets that you're allowed to have in Medicare in order to qualify for low-income subsidies. We're going to move that number up so seniors will have more access to get a subsidy for their Medicare. So I think this is a real win for seniors. It's a real win for Medicare, and it helps us really begin to reduce the cost. And just let me say lastly before we start taking some questions, right now, 4 cents of every dollar that we spend in healthcare in the United States is spent on prevention. 4 cents of every dollar. And we all know that we are going to be able to save a lot of money if we start focusing our system on preventing problems, making sure we catch the cancer early, make sure we catch the heart disease early, make sure we catch a lot of these problems early instead of waiting until they become chronic and very expensive, waiting until people show up in the emergency room. So if we can get that number up and spend more on prevention, we're going to save more in the long run. And that's what we do with the Medicare. We also get rid of all the cost sharing for preventative coverage in Medicare. So you're going to get an increase in your prescription drug coverage. You're going to get an increase in your ability to qualify for a low-income subsidy because we'll raise, the asset level higher, so you'll be able to qualify. And your preventative coverage, there'll be no copay for that. So this is a real win. This is going to secure Medicare and I think help us save a lot of money in the long run. So I'll be happy to take any questions. I think we've got a little time to try to answer everyone's questions. I appreciate you being on this call and being interested in this. And let me just say lastly before I forget too, just one suggestion. If you are watching MSNBC all the time, if that's the station that you watch, you should watch Fox News for a week. And if you're watching Fox News for a week, permanently, that's what you watch, you should watch MSNBC for a week. I think that the polarization of media right now is giving a lot of misinformation, in some instances on both sides. So I think if you really want to get the story, you want to listen to both sides. So if you're listening to Fox, listen to MSNBC. If you're watching MSNBC, watch Fox, and we'll be able to, I think, get to the truth of this matter. So I'm happy to answer any questions, Patrick, if you want to start patching.
Yep, I think CNN might feel a little left out there, but
well,
we'll get ready to take people's questions. Again, if you'd like to ask a question to the Congressman, all you have to do is press 0 on your phone at any time throughout the event, and we'll get you in line. Our first question is going to be from Regina in Cortland. Regina, are you there?
Hi, Regina. Hi,
Are
Regina.
you waiting for me? I recorded my question.
Oh, well, go ahead and ask it.
My question is about the donut hole in for Medicare. Each year in August, I have hit the donut hole by August. In September, then I'm paying full price for my prescriptions. Actually, you answered my question in your talk earlier.
Yeah,
so thank you.
You're welcome, and this is exactly why we're doing it. We get calls to the office, and I meet seniors all the time where, there are people who qualify for the Part D, get into Part D, and then, middle of the year, they get hit. And so, again, our benefit package, the agreement that President Obama struck with the pharmaceutical companies is that if you currently fall into the donut hole, there will be a 50% discount on your prescription drugs, not generic, the top shelf prescription drug. There will be a 50% discount. And then as we get the bill moving forward, I think in 2011 we closed the gap by $500, and then over the next few years we completely fill the donut hole. So it's a big part of this, and it's something that we haven't done a good job of letting our seniors know about. So happy to take the next question.
Next up, we have Carolyn from Warren.
Yeah, this is Carolyn Reed, Tim, and I was worried about, the president keeps saying that if I like my insurance, I can keep it. Well, I get insurance from General Electric, and, that was my company. Well,
right.
They seem to have aligned themselves with the president, which is fine, but what if they decide to change? Then I have to change, too, whether I want to or not.
Well, if you're getting your employer coverage now and your employer changes, then, yeah, you're going to have to change. But you're under that right now, too. Employers are always shopping around to try to find different coverage. But here's the advantage you're going to have now. If you want to go out on your own, you can go out on your own and into the market and into the exchange and qualify for all of these other health care programs. And the good part about it is, in our reform package, an insurance company has to cover you. So today, if you lose your job and you go into the insurance market, they can say, oh, you have cancer and it hasn't been gone for 10 years, so we're not going to cover you. Or they charge you, $2,000 or $3,000 a month. Under the reform, they have to cover you. There is a maximum amount a year that you will have to pay, which means no one in the United States will go bankrupt because of health care costs again. And they will not be able to, if you do get coverage and then you do get sick midterm, they can't kick you off. So there's a lot of consumer protections in here now. But at the end of the day, this is going to save General Electric and General Motors, and we all know we're excited about the new second shift at General Motors now. You know, it's going to help big companies too, because the system is costing everybody so much money. So you're a General Electric employee now. You've over the last, probably 10 years have had to pay more in your copay, more your premium. You've been asked to pay more as an employee, and that's because we have all of these uninsured people go to the emergency room. They don't pay, and then you go with your card to your doctor or to the hospital, and their coverage is basically pushed off on you, and that's why you're seeing the increase. So we're going to fix that problem. But yeah, there's a lot more protections now, but to some level you will be susceptible to the employer as far as what the employer coverage is.
Next up, we have William from Warren. William, are you there?
Yes.
Hi, William.
No, I'm not William.
Oh, okay. Well, I got William's question here. Want me to just read it, Patrick?
Sure.
William Rogers from Warren.
This is Donna Rogers from Warren. This is his wife.
Go ahead, Donna.
I was just interested to know if the president and his family and all the congressmen and senators would be under the same plan.
Not the federal plan. I have made this commitment that if there is a public plan in this bill, which I'm not sure there will be or not, I will go into the public plan. Tim Ryan will go into the public plan. That's how confident I am that it'll be solid coverage. But we're under the federal employees plan, which is set up just like what we're trying to set up. We're actually trying to give everyone in America the same opportunity we have to have this exchange of different private plans that you can go to and pick from those plans exactly what the coverage you want. So we're setting up an exchange that's very, very similar to what federal employees have, and it's been fairly decent, and it worked. And I think it's an opportunity for us to, say, hey, average Americans should have the same coverage that their elected officials have. So we're trying to give you what the federal employees have now.
Next up, we have Diana from Newton Falls.
This is Terry Coons, Diana's husband.
Hi, Terry. Tim Ryan.
How are you, sir?
Doing good, sir.
I have a question. Are we going to have to cover illegal aliens in this bill?
No. That is one of the most common misnomers, and I want everybody to be clear. There is Section 246 of the bill says that no illegal aliens will be covered under this bill at all. And you'll notice that we don't ever say we're covering 100% of Americans. We're only covering 97%. And the reason is that we're not covering illegal aliens. And a lot of the system is going to continue under the current employer-based system. So employers aren't allowed to hire illegal immigrants, so therefore they won't, they won't be able to go through the employer plan either. But you cannot be an illegal immigrant and participate in this program. That would never pass Congress. Nobody would support it. I certainly would not support using public tax dollars to do that. So we need to be clear, and I hope everyone will tell your friends and family, because I know this has been a concern. It's in Section 246 of the bill, of the most recent House version that just passed a few weeks ago. And again, this bill does not cover illegal immigrants.
Again, if you'd like to ask the Congressman a question, all you have to do is press 0 on your phone at any time to get in line. Next up, we have Richard from Youngstown.
Hi, Richard.
Hi, Congressman. How are you?
Yes, I'm doing great.
My question is, are you going to support the public option?
Yes, I am supportive of the public option. I think it's important to have it in there for us to cover or for us to control costs. The original version we had in the House, and just so everybody knows, the public option is in essence going to be an opportunity in this exchange. So we'll have what we're calling the exchange, where all these private insurers will be able to go in and offer coverage. We will set, the Surgeon General and a panel of experts, physicians and otherwise, will set a basic plan. Basically, every plan that goes into the exchange has a basic level of coverage for hospitals and maternity care and all the prevention that we need to save money down the line. Also in that, we want to have what's called this public option. It's basically a smaller version of the Medicare system where you will pay premiums, you will, do your co-pays, people will, still have to pay their own way there. No one will be forced into it, but what it will do is it will compete with all the private plans. And there are a couple of versions in the House, but basically it says the public option could negotiate for payments and otherwise. They can pay the Medicare rate plus 5% and no higher. And there's other versions that change that. But in essence, we're saying if you would pay a doctor, hospital, provider, Medicare plus 5%, the doctor, the hospital, the provider, everyone's going to make a profit, but you're not going to have the profit motive that the insurance companies have. So the insurance companies that are charging 10 or 15% and having all of these increases will now have to compete with a Medicare-style program in the public option. And we feel like that's going to control the cost. So I'm supportive of the public option. I don't know where it's going to end up at the end of the day, but I think it's a good opportunity. It's choice. And the one thing we want for everybody here is choice. So people in the insurance market can have their choice if they want to go into this public option. And it's going to be paid with, private co-pays and premium dollars and everything else to keep it running. And no one's going to be forced into it either. It's going to be choice. If you want to go into it, you can go into it. If an employer wants to take their small business into the public option, they can go into it. Now, the Congressional Budget Office that they're nonpartisan. They kick the Democrats' butts on certain issues, and they kick the Republicans' butts. They're really nonpartisan on how they analyze different legislative proposals. They said in a decade there will only be 10 to 15 million people that would go into the public option. So all this nonsense you're hearing, like everyone's going to be forced into the public option, that's not true. No one's going to get forced into anything. There's going to be all these insurance companies, private, competing, and then this public option that's going to have to compete with them as well, and you can go out and have your choice. And you're not going to be forced to go into anyone, but what the insurance companies are going to be forced to do, they're going to be forced to cover everyone. They're going to be forced to not deny you coverage because you have a pre-existing condition, heart disease, diabetes, all of those things that you could now lose your coverage for. They'll still have to cover you, and they can't kick you off. So I'm supportive of the public option. We'll see what happens.
Next up, we have Anna from Niles.
Hello.
Hi, Anna. How are you?
I'm good, thanks. How are you, sir?
I'm good.
Good.
Go right ahead.
My question is on abortion. And do you know, first of all, if we're going to be forced to, by our taxes, to pay for that, if it's going to be covered, and if it is all the way through partial birth abortion, are they also going to cover the other end of the spectrum, which would be fertility, all the way through to in vitro?
There will not be public funding for abortions. There was an amendment that I helped draft the language to that said an abortion cannot be paid for by public dollars in this health care program. It basically extends current law that we have in place now that says no public funding for abortion. It's almost unanimous in Congress that there should not be public money spent on abortion. And I will not support a bill that publicly funds abortion. And there's a lot of, those of you who want to check it out, St. Petersburg Times newspaper has a fact check on their website that you can go to, and they take all these different accusations of public funding for abortion, illegal funding for illegal aliens, and they have denounced saying that the accusations that this publicly funds abortion are not true. Independent people who have looked at this said it's not true. I will not support a bill that publicly funds an abortion. I am pro-life. I have voted against the partial birth abortion. I have voted for parental consent for minors to have to cross. I've, voted against human cloning. So I have a pretty consistent pro-life record, and included in that is no public funding for abortion. So we'll make sure that that's not in there. On the other end, for the fertility side, each plan is going to be different. Each private, because it's going to be basically like private insurance is now. So this is what I'm saying. People are saying we're going to force one thing or the other. The private insurance companies are going to offer coverage. Some may include in vitro and fertility issues. Some may not. It's all going to depend on what the private plan asks for. And people will be able to go to the private plan and pick out if they want to go and get that coverage or not.
Next up, we have Albert from Cortland.
Yes, good morning.
Hi, Albert. How are you?
I'm good, thanks. My question is, the Congressional Budget Office has said that the bills as written are going to increase the budget deficit and add the higher taxes. I'm wondering what your response to that is.
I appreciate that. I'm glad you asked that question. First of all, on the higher taxes, there will not be any taxes on people who make less than $500,000 a year. That is clear. I feel like middle-class people have been paying higher taxes, a higher rate of taxes. I feel like their health care has been going up, and they've been burdened enough. What we're trying to do is, and there's a couple of versions, but one of the versions in the House says that there will be a surcharge on people who make, an individual who makes $500,000 a year and a couple that makes more than $1 million a year. And there will be a surcharge, and I think they'll end up paying another $50,000 or $100,000. I'm not even sure if it's that much, maybe about $50,000 more in taxes. But if you're anywhere under $500,000, you're clean, you're good to go. And that number of 500,000 and million protects up to like 97% of small businesses too, because a lot of small businesses couples own and they fall into that category. But only 3% would fall into that category around the country, and I think only 1,000 people in my congressional district out of almost 700,000 people, only 1,000 would be hit by that higher end income. And then so you'll be free, and again, middle class people are going to see a reduction in their health care costs because we're going to bend this cost curve. We're going to do the prevention and fix the system. So a lot of people will see, it won't be a tax cut per se, but they'll see a reduction in health care, which means health care costs for the family, which means a reduction in their benefits. It's important to note too that if we don't do anything, the average family will pay $1,800 increase in health care next year if we just don't do anything. So that's why we need to get something done, because next year everyone's going to see a family of four, average family will see an $1,800 increase. The Congressional Budget Office, as I said earlier, has been pretty impartial as to dishing out criticism of different legislative proposals. So they said that the Democratic plan would increase costs for over time and blow up the budget. The problem with the CBO analysis is they take our plan, but they do not account for prevention. So I don't know how you can actually analyze a health care reform proposal and not include a analysis of how much the preventative aspects of the plan are going to save you. Now, that's where we get a lot of our savings. If we have all of a sudden everyone from 55 to Medicare age has health care, or 50 to everyone's going to have health care, but this core group now that has been going into health care unhealthy, costing us all this money, if all of a sudden they have preventative coverage and they're getting things done before they become chronic problems, that can be handled with prescription drugs instead of getting chronic and needing surgery, you have to factor that into your long-term costs. And the Congressional Budget Office hasn't done that. If we take 50 million people and instead of dumping them into the emergency room, it costing everybody billions and billions of dollars, they have a basic plan that they can get into that they're also going to have to pay for. No one's getting a free ride here. Even those people who are going to now qualify for coverage, they're going to have to pay their co-pays. They're going to have to pay their premiums. Everyone's got to have some skin in the game on this thing. But take all those 50 million people now have preventative care instead of getting dumped into the emergency room. That's going to save us a heck of a lot of money. So the Congressional Budget Office did not factor any of that in. So we feel that that's an unfair analysis of it, because it doesn't take into the prevention. So we're going to see significant cost savings with this. And I think the Senate version, I don't have it in front of me, but I think the Senate version reflects that we are going to save money in the long run.
Next up, we have Edward from Niles. Edward, are you there? Okay, Edward hung up. Let's go to Eugene from Warren. Eugene's not there as well. Let's go to Doris from Hubbard.
Hello.
Hello, Dorothy.
No, this is Marlene from Niles.
Oh, okay. Go ahead, Marlene.
Okay, I have a question.
Yes.
I had pre-existing cancer. I had eye surgery that's pre-existing, and I had dental that was pre-existing. Okay, now, my husband worked at General Motors. I'm no longer covered with those three, catastrophic. If I get another insurance, medical insurance, will it be covered because that is considered catastrophic? And it'll be a pre-existing, and they won't cover it. So what am I supposed to do?
Well, and that is, you are the poster child for why we need to do this and why we need to do it sooner rather than later.
Okay, I'm 62, so I don't qualify for Medicaid or Medicare.
Okay, well, exactly. So here's under the current system. Under the current system, you have what you have now. You're getting denied. You can't get catastrophic. You're getting denied for pre-existing conditions, or you're paying through the nose for it.
Yeah, I work 2 jobs.
Well, there you have it. I mean, you're exactly why we're doing this. Under our reform proposal, at your age, you will be able to either your employer will be having an employer coverage, and you will then go into the system with your employer, or your absolute worst case scenario is that you will be able to, as an individual, go to the exchange, and where there'll be all these plans and hopefully a public option as well. If you make, and so you'll be able to pick your coverage. If you make, under our proposal, if you're a family of 4 and you make under $80,000 a year, you will qualify for what we're calling a credit. And this credit will help you pay for, it will basically subsidize your health care coverage. So first of all, no one in the exchange will be able to deny you coverage because of any of your pre-existing conditions. It does not matter how bad or how sick you are, they will have to take you, and they will have to cover you. And then under this program, because of the surcharge that we're putting on millionaires and because of the savings that we're going to have, we will provide credits for people who, families of 4 making under $80,000 a year, and there will be a scale, graduated scale. The poorer you are, the more you'll receive, up to $80,000 a year. You will get a credit. So you'll go to the market. They won't be able to deny you coverage. You will have a subsidy that will help you pay for it, and there will be a cap on just how much you will have to pay a year. And under the current proposal, and again, these numbers may change, but under the current proposal, you will not have to pay more than $5,000 out of pocket a year for a catastrophic. And, that's still a lot in my mind, but it's a heck of a lot better now than people having to pay hundreds of thousands of dollars and go bankrupt. So this plan is made for you. you should have the flag out front of your front yard saying we need health care reform, because this is something that will and we hear from people like you all the time, and there are thousands of people in our community. We had them do an analysis of our congressional district, the 17th district, which goes from Akron, Portage, Trumbull, Mahoning, and they said that.
You live in, I don't know if you do now, but you did live in Niles.
Yeah, I live in Niles. I still live there.
I live over by the high school.
Oh, okay. Well, yeah. I mean, we're almost neighbors, and
yeah, you just live up the road.
That's it. So you will be covered under this, and you are why we're doing this. And what's happening now is, as or someone like you has all of these pre-existing conditions. If you're not getting coverage, if you're not getting treatment, if you continue to get denied, you're only going to get sicker, and that's only going to cost everybody more money in the long run. So the one point, again, I want to emphasize is that we already pay for people who don't have health insurance. We all already pay. If you're in Medicare, we pay, and so this is an opportunity for us to do this. But I appreciate the call. Thank you.
Okay, I have a question. Could you do... I work at Holiday Inn.
Is this Marlene still?
Yes.
Okay.
On 46, Mr. Savellini, which he passed away.
Yep.
Could you come there and have a meeting in our rooms?
I'd be happy to. Why don't you call my office in Warren, and I'll be happy to set up a meeting, come over and have some coffee with you.
Okay, they have.
Okay, you know what, Marlene? I got a bunch of people who want to ask questions too.
Okay.
There. Okay.
Sure. I will
Thank
call you this week.
Okay, call Debbie. Okay.
Cool.
All right. Bye.
Next up, we have Willie from Leavittsburg.
Hi, Willie. Or this Phyllis?
This is Phyllis. We met you at the GM retiree meeting.
Oh, okay. Okay. How are you?
I'm not doing too good. I have arthritis really bad. My question is, when Willie gets antibiotics a lot, and I went to CVS. You can't do the antibiotics through the mail-in, but we go through Medco. 1 week, 10 pills was $5. The next time I filled it, it was $25, and I don't understand why they can do that. I'd like to know if there's going to be a cap on how much they can charge for medication. And if you call and your doctor don't write the prescription for 3 months, you pay $50 for a name brand medicine for 1 month, and you get it through Medco, then it's $50 for 3 months, and they don't tell you that.
Well, that's a good question, and this again, the reform here will address prescription drug coverage. It will actually, if you're on Medicare, we will begin to fill what's now known as the donut hole. Medicare Part D covers up to $2,700 in prescription drug coverage. And then the coverage falls off for a couple $1,000s, and then it picks back up at around $5,000. So there's this big hole where people in July or August end up running out of coverage. And what we're saying is that through the savings, we will begin to move towards closing that donut hole so all seniors will have eventually all of their prescription drugs paid for. In the meantime, President Obama has struck a deal with the pharmaceutical companies saying that if they provide name brand prescription drugs, if you fall into the donut hole, the pharmaceutical industry will provide a 50% discount for those pharmaceuticals that you'll be buying while you're in the donut hole. So there'll be an automatic 50% decrease, and then over the next few years, we will begin closing the gap in the donut hole. In addition to that, there will be increased consumer protections, because we hear all of these stories all the time about you're paying $5 this week, and then next week you're paying $25 and all these things. So in Medicare and in the healthcare system as a whole, we are going to increase our ability to monitor some of these situations that happen so that the consumer will consistently be advocated for and protected, and we're going to pull doctors and other providers in to help us do that.
Next up, we have Joanne from Youngstown.
Hi, Congressman
Joanne.
Ryan. Yes, you've been addressing some of the issues with the so-called myths.
Yes.
The one I haven't heard yet was the euthanasia issue. I understand it was tied to living wills, but it was handled in such a way that it was frightening. I would like your take on that issue.
Oh, I'm so glad you called and asked that because I forgot to address it. If this isn't reason enough to know that there are some people that just don't want health care reform, that they're willing to say that, our reform proposal is going to, as some have said, pull the plug on our grandmothers, is just absolutely ridiculous. Let me tell you where this claim is based, very loosely based, but this is where people base it. There is an opportunity for patients to ask their doctors for what's going to happen end of life. And, I grew up 2 streets from my grandmother and my grandfather in Niles, and they were, in our lives every single day. And towards the end of their life, they both passed away about 4 or 5 years ago. And my brother and I and my mom were all there when my grandmother passed away and my grandfather passed away. There are, in those last weeks, months, years, some difficult conversations that families have to have. We're saying that the physician, the doctor, should be in making these decisions with the patient. The government is not going to make any of these decisions. So what they're basing this euthanasia claim on is a provision in the bill that says if the patient, not the government, not anybody else, but if the patient wants to have a conversation about living wills or hospice care, if they want to have this conversation, if the patient initiates it and wants to have a conversation with the doctor, that the Medicare will reimburse the doctor for a 30-minute conversation. That's all this provision says. The doctor doesn't say to the patient, hey, we need to have a conversation. This all needs to be initiated by the patient, and all we're saying is we should reimburse the doctor for their services because they're providing a service to a patient in Medicare. So please, having been through this with my grandparents, and my mom is now on Medicare, and all of my aunts and uncles and great aunts and uncles are on Medicare. I mean, those of you who have met me and know me, I would never support anything like that. That is just the most asinine thing I've ever heard in my life. So please don't let anyone scare you. There is no death panel. There's no euthanasia. There's none of this nonsense that they keep talking about, and it's scaring seniors in my district, and it's really upsetting me that the media keeps perpetuating this. The only thing that the government will do, the only thing this legislation will do, is to outline a basic plan saying that every private insurance company has to cover, for example, preventative care, hospitalization, all of these maternity care. That's all. We're just going to set the basic parameters, but it will still, we make sure that no one can be denied pre-existing condition. But after that, it's your choice as to where you want to go and what you want to do, and we're really trying to hold sacred the relationship between the doctor and the patient. So there's none of this nonsense about, pulling the plug on our grandmothers. It's offensive. It's wrong to try to scare seniors. If you don't like health care reform for whatever reason, just, explain to everyone why you don't like it. You don't have to say we're covering illegal immigrants when we're not. You don't have to say we're going to pull the plug on our grandparents when we're not. I mean, it's just nonsense. So I appreciate the question. So we get an opportunity to clear that up.
Again, if you'd like to ask the Congressman a question, all you have to do is press 0 on your phone at any time. Next up, we have Charles from Warren.
Hello.
Hi, Charles.
Congressman Ryan.
How are you?
Yes, sir. I'll tell you, I appreciate everything that you've done for us so far, and I certainly hope that you'll continue to champion our cause here in the Valley, being the Delphi-Packard people. What is being done, Congressman, Representative, I should say, Ryan, about this situation?
Well, there's two things we're trying to do for the Delphi folks. One we have already done. We've been, in fact, I just talked to Governor Strickland yesterday. He's meeting with Tim Geithner today in Berea, and I called the governor just to, express my views that when he gets eyeball to eyeball with Tim Geithner, that, he needs to really express from my district, the need that we have to help our Delphi employees, both salary and union. One of the things that we had included into the stimulus package was an extension of the health care tax credit, which says if your pension goes to the PBGC, Pension Benefit Guaranty Corporation, that you will qualify for an 80% health care tax credit, which means you'll be able to, in some instances, in many instances, actually get money up front, up to 80% of your health care costs, to try to relieve that. And I think that's a pretty significant step to try to help a lot of those folks who have lost health care and, may get some basic catastrophic coverage. I don't exactly know what the end plan is going to be, but whatever it is, if you have a $10,000 health care bill, it's now going to be $2,000 over the course of a year because of this health care tax credit that the Democrats put into the stimulus bill. And that extends to, I think, through this year and all the way into next year. We'll probably have to get that extended, but that is something that is directly qualifying for the Delphi folks. And then also in the health care reform bill, I think there's about, I don't have it right at my fingertips here, but I can probably find it for you. There is a pot of money, I think it's about $10 billion in the House version, that will help people who have lost their job and are between the ages of 55 and Medicare. There will be a pot of money there. I don't know if it's going to be enough for everybody, but it's primarily for people in the auto industry who, again, are in that late age where they're just under Medicare, but not still covered because of a bankruptcy. And so there's a pot of money in there. So the health care tax credit and that. And then the Pension Benefit Guaranty Corporation, they have a formula that's going to help the Delphi people who moved into the PBGC. I know that the union side is still negotiating, and I'm not exactly sure what's going on there, but I have made calls to Fritz Henderson, the CEO of General Motors, and explained, my dismay with how they have left a lot of these Delphi folks behind. So we've been pushing. We've wrote letters, Sherrod Brown, Betty Sutton, Charlie Wilson. We've all wrote letters, made phone calls. I call Ron Bloom almost weekly and, make sure he doesn't forget us. So we're working hard on it, and, it's unfortunate what's happening, and it's, heartbreaking, but we're going to continue to try to soften the blow the best we can and make the Delphi workers whole.
I think we have time for a few more questions. Let's go to John from Warren next. Oh, Patty, sorry.
Hi,
Patty, are you there?
Is that Patty?
John, go ahead.
Did you say Patty?
Patty or John, whoever's there.
Well, Patty couldn't wait. She had to go to work. Anyway, is this Tim Ryan?
Yes, sir. Go ahead, John.
Hi. Yeah, this is Patty's husband. She had to go.
Okay, go ahead.
Tim, two parts. Just very, very quickly. This thing isn't going to go effective until 2013, if in fact it does. There's going to be two more congressional elections since then. Being that there's so many questions to this thing, and your Obama took 6 months to pick a dog. Why would we rush into this thing when you guys go back from recess? That's one thing, okay? You mentioned that you would take the public plan, right?
Yeah.
Now, my question to you, Tim, is this. Will you offer an amendment when you go back to your fellow representatives mandating that all federal employees become part of this plan before you vote on it. Will you make that pledge?
Well, the federal people, I don't think we should force anybody, John, into anything. And the federal people are already into a similar exchange. What we're trying to do is lift everybody up to the federal level now. And so I don't think it's right for us to force anybody to do anything. The key here is choice. And I said just, on my own, I will, go into the public option. I have absolutely no concerns about it. I would go into it. I will pay whatever, needs to be paid to go into it as well. And the question about, why do we need to do this? If we don't do something, the average family next year, it doesn't start till 2013, and Mr. Canzanetta is exactly correct. It doesn't go until 2013. We want to give this some time to get implemented and to make sure it's set up properly and everything else. But at the same time, if we do nothing, there will be an $1,800 increase in the average person's wages or average person's family's health care cost next year, $1,800 increase. And small business increases have gone up 129% over the last, 6 or 7 years. So the longer we wait, the more we pay, the more it burdens the system, the more it costs the government.
Our last question will come from Alex from Youngstown. Alex, are you there?
Are you there? Yeah, I'm there.
Yeah, go ahead, Alex.
I'm 85 years old. My wife's 82. We both have chronic ailments. We have to get 3 to 4 blood tests a year. And we have to go to the doctors. Like, if it flares up, we have to go to the doctor for maybe next week. Sometimes we wait 3 or 4 months, but sometimes we go twice in a week. Mm-hmm. Will that be taken from us, that we ain't allowed to go that often or get that many blood tests?
No, all of this is going to be based on what your doctor thinks you need to do. And in all the different, in Medicare, we want to try to really empower the doctor. And so if the doctor believes that you need to continue to have blood tests done, then we will continue to pay for it, because we want to make sure that, it doesn't cost us more money. If you don't get your blood test, then we don't know what's going on with you, and then, ultimately it's going to cost everybody more money. So no, we are not going to reduce that. Those decisions are going to continue to be administered, and those decisions are going to continue to be made by the doctor.
That was our last question, Congressman.
Okay. Let me just reiterate, how much time do we have, Patrick?
As much as you want.
Okay. Let me just say, because I'm scrolling through some of the questions that are here, and if people got on late, I want to just reiterate a couple of points just to close. And we're going to do another one of these. I hope you found it useful. I know I have. We're going to do another couple of these, I think, in the next week or two, and continue to go out and about and talk to folks about this. Here's a couple of points that I want to make. Again, we're doing this because healthcare costs are going up 9% a year, and our overall economy is only growing at 3% a year. And that means that healthcare continues to eat up more and more and more of our economy. One of every $5 will be spent on healthcare in the next 10 years. One of every $3 in the next 30 years. People now are paying an extra $1,100 in premiums that they don't need to be paying. And next year, if we do nothing, the average family will pay an extra $1,800 in health care costs next year. We have a problem. We spend twice as much on health care, I think over $6,000 a person compared to other countries. And we have a worse infant mortality rate. We have a less life expectancy than some of these countries because our system isn't working. And so what we want to do is pay for this. This whole thing is paid for. There will be a surcharge on couples that make more than $1 million a year. and we will save a lot of money because all of these people now who don't have health care, up to 50 million of those people will go into, they go into emergency rooms, and they don't have coverage. So that doctor and that hospital, they don't get paid for that. And so when you go, if you have health insurance, you end up having an increase in your payment because you're putting the bill for those people who don't have coverage. So what we want to do, and those people who come to the emergency room are much, much sicker than they need to be because they don't have any preventative care. So what this plan does is it gets everybody covered so that everyone has preventative care so that they can get screenings for breast cancer or any other kinds of cancer so that they don't show up in the emergency room and need surgery, which costs everybody more money. So we're already paying for these people. We might as well cover them and give them preventative care, and that's how we're going to save an enormous amount of money for the healthcare system by getting these people some preventative coverage. Our plan says that you cannot be denied coverage because you have a pre-existing condition. No one can kick you off their insurance if you get cancer or have some kind of accident. They have to continue to cover you. Everybody will have coverage, and they can't dramatically increase your insurance rates because you get sick. This is a win-win-win for working people, for average people, and for small businesses. Small businesses have seen a 129% increase in their health care costs over the course of the last 5 or 6 years. And by allowing small businesses with 10, 15, 20, 30, 50 employees, 99 employees, go into this exchange and be able to pool their resources with millions of other people, they will get a better deal, and that will save small businesses a lot of money. And that's really what we want to do. Some of the myths that have been up here. This bill does not cover illegal immigrants, and I've seen a lot of people who are in the queue here who have typed their question who we're not going to be able to get to ask about this. This bill specifically in Section 246 says we will not pay 1 penny to cover an illegal immigrant. An illegal immigrant already can't get hired by an employer. That is illegal to hire an illegal immigrant. And so, therefore, they won't be in the employer-based coverage. They won't be covered by the new health care exchange. No illegal immigrant will be covered here. There will be no euthanasia, no Sarah Palin death panel. The only thing that we will do in this legislation is have a panel set up. What is the basic coverage that every insurance company in the country needs to provide? There needs to be a basic level of coverage. That's the only thing the government sets, and then the insurance companies have to meet that, and they can't deny for pre-existing coverage. Heart disease, cancer, diabetes can't deny coverage there and can't throw anybody off the rolls. So no illegal immigrants. There'll be no euthanasia. The euthanasia rumor, again, to reiterate for some people who have just gotten on, that is based on a provision in the bill that if a patient asks their doctor about hospice or about a living will, that the doctor will be reimbursed for up to a 30-minute conversation that the patient wants to have about those issues of hospice and living will. This does not force the patient to have the conversation. This does not force the doctor to force the patient to have the conversation. This is the patient initiating it on their own, and Medicare saying we should reimburse the doctor for that service because it's a service to the patient. And that's where many people who are trying to kill the health care reform are saying that. So that is not true as well. This is paid for by a surcharge on millionaires and also on all of the savings that will generate from the prevention. And then lastly, on Medicare, this is a win-win-win for people on Medicare. This will close up the donut hole. So if you get Medicare Part D, this will cover you. This will make sure that we fill that gap, and over the course of the next few years, we will close that gap completely. This will allow Medicare to negotiate down drug prices. There will be no cuts to hospice or anything like that. This is going to shore up Medicare for the long term. So I believe that we need to do this. I'm so glad that so many people have participated in this. We wanted to make sure that we reached out to people, our senior citizens and those people who were on Medicare, because there's been so many rumors and so many false accusations. We wanted to clear it up. If you have any questions, you can certainly call my office at any time. But this is a win for Medicare. This is a win for people who have been denied coverage and they're tired of having to struggle and fight the insurance companies. We just want to, we're not here to kill the insurance industry, but what we are here to do is make everyone play fairly and say that, healthcare is a human right that we all have, and in the wealthiest country in America, we shouldn't be wasting so much money by administering our healthcare program through the emergency room. This is not a Canadian-style plan, and that's another thing people are saying. This is socialized medicine. It is not. This is a uniquely American healthcare initiative, and that private insurance will still have to, they still will be participating. They'll still be making money. It won't be as much as they normally make, but they'll have to cover everybody, and they won't have all this nonsense of denying people for their pre-existing conditions and all those things. So this is something that I'm going to continue to push for. We want to be thoughtful, but we want to make sure that everyone here who will get coverage. And then lastly, let me just say this, that they will have skin in the game. These 50 million people who don't have health insurance, they don't pay anything right now. They go to the emergency room and they pay zero. We are saying that they will be in the system, they will have co-pays, they will have premiums, just like everybody else, and we will get them into the system. So I hope that over the course of the next few months and weeks that you pay very close attention. As I said at the beginning, if you watch MSNBC or CNN regularly, take a week and watch Fox News. And if you watch Fox News regularly, take a week and watch CNN or watch MSNBC, because you'll get different kinds of information, and sometimes one station rebuts the accusations of another. And I think it's important that if you hear everything, I think you'll, at the end of the day, realize that this is a good thing. There are people out there who are scared to death that this is going to pass, and we're going to make sure that our people in this community are taken care of. And again, I won't support anything that funds abortions. I won't support anything that funds illegal immigrants. I won't support anything that would in any way force a senior to make a health care decision that they don't want to make. And I'm only going to vote for something that at the end of the day is good for business around here. And that's what's happening. We're going to make sure our small businesses can grow and thrive. And, we've got a good program, I think, going locally. We've, General Motors adding another shift. We've got a good deal going with V&M Star. Youngstown's one of the top 10 places in which to start a business. We got to keep that going, and a big part of that is making sure everybody has health care. So, again, thank you for taking time. I appreciate you doing this. Patrick, thank you. And if you have any questions, you can call or email on my webpage, or call and email my staff at any time. And we'll be out and about over the course of the next 3 weeks before I go back to hear your concerns. So thank you very much.
Thank you, everyone. You'll now have the opportunity to leave a voicemail if we didn't get to your question, or if you'd like to leave a comment, and the Congressman will get back to you individually shortly. And thanks again for joining us. Bye.